Hey guys, welcome back to my channel. If you're new, my name is Haley, and before I get into any of this video, I just want to state here at the beginning that I'm fine, or as far as I know I'm fine, and thankfully everything turned out okay. But whatever I have decided to title this video, no, it's not clickbait. My mom did call 911 on me last week, and I went to the ER by way of an ambulance. So everything started last Thursday. Today is Wednesday, so tomorrow will be exactly a week, but last Thursday I woke up and I was totally fine, totally like at my baseline. I woke up, ate my breakfast, took my medications, and I had started my day. It had been about 15 to 20 minutes since I last, swallowed any of my medications or drank any water or anything like that. But I had begun to start my day by putting away some dishes that were on the counter, so I wasn't even really exerting myself. I wasn't bending over or anything like that whatsoever. But as I started to put the dishes away, I started coughing, and I also felt short of breath at the same time, which was really weird. But sometimes you cough for no specific reason. You swallow just right. There's something in the air that irritates you. So I elected to stop doing the dishes and sit down at the table and take a few sips of water to see if that would help. And that did not help. And then I tried to kind of regulate my breathing and take some deep breaths. And that's when I realized that every time I would take a deep breath, I would cough quite a bit. And I wouldn't just cough, but my chest would start feeling tight and it would radiate to the base of my throat. So I had that combined with feeling very out of breath. I called my mom downstairs just for a second opinion. I'm like, am I going crazy? I don't know. Please come down here. And so she came down and she noticed I was clammy and I looked more pale than I typically am. I'm a very pale person, but I was definitely more pale than I typically am. And I made my way to my room and I sat on the edge of my bed and I realized I felt like I could not breathe laying down. I would try to lay down and I felt so out of breath, and just getting to my bedroom, which isn't very far from the kitchen table, made me really, really winded. I did discover though that if I sat in one spot and did not move a muscle and I focused all of my energy and thoughts on shallowly breathing through my nose, I was okay. I would talk barely above a whisper, but I was okay. That was my defense to my mom that I was fine. That is not normal at all for that to be a thing at all. So my dad ended up leaving work and he was going to come to take me to the ER. And I have a really complex health history if you're not familiar with me. And if you do, you know. So the local ER is not my first choice, and that's why he was going to drive me to a different ER. Well, in the span of waiting for him to get home, I became more and more winded. I went to brush my teeth, and that took so much out of me. And that's when my mom was like, let me call some people. So she tried to get a hold of some nurse friends of ours, and she couldn't get through to them. But then she got through to my uncle, who is a firefighter or EMT. And he was like, I would call 911 because all of this does not sound good and I wouldn't wait. And so my mom decided to call 911 and I was really, really mad. I was very, very angry and upset at her. I did not want her to call an ambulance. I did not want that whole thing because I know that meant I would go to the local ER and I did not want to deal with the local ER. And our chief concern all around, and what my uncle was concerned with as well, was a pulmonary embolism. I have a central line in my chest, and I do IV fluid infusions every night. And from the time I got my first central line almost 10 years ago, I have been told that I am at a higher risk for blood clots and pulmonary embolisms. That's just the nature of having a central line. You have added risks. So knowing that and having these symptoms come on really suddenly really concerned us all and pushed my mom to call 911. So the paramedics came, they evaluated me, did their thing, took the history from my mom. I was barely talking above a whisper, so it was really hard for them to hear me and understand what I was saying. But as they moved me onto the stretcher, I felt so winded and so out of breath just from moving from a chair to a stretcher. On the way to the ER, the EMTs discovered that my local ER was on redirect, which basically just means they weren't accepting any new patients by ambulance or really anything. I ended up going to an ER that was still local, but further away. And this whole experience really makes me wish my closer local ER was not on redirect, because I would have taken that any day over what I experienced. So I get to the ER, and I also want to stress this ER was so quiet you could hear a pin drop. It was not busy. I've been in busy ERs. I've been in quiet ERs. This was quieter than the quiet ERs that I've experienced in the past. And I'm also used to waiting. In the hospital and ERs, hospital time is a very real thing. Things are much slower in a hospital. I get that and I understand that, and I really feel like I'm very gracious for the most part when waiting. But this was just a whole nother ridiculous level. So I got there and I got into a room pretty quick. And once I got into the room, all that happened was the nurse I had connected me to the blood pressure cuff and put the pulse ox sticker on my finger, and that was it. He asked a few brief questions about my medical history, but I did not have a doctor see me or look at me or even have a nurse do an examination on me for 3 hours. In that 3 hours, there was nothing ordered. No tests, no blood work, and nothing. I was not looked at. And again, this was a very quiet ER, like a very, very quiet. There was empty rooms, like there was no doctor to be seen. And so finally I had my mom go out and demand that the doctor come in and see me, because it was ridiculous at that point. And he finally came in and saw me, and I felt like he did not take me seriously. When he came in, I could tell he did not look at the chart at all. And yes, doctors always ask the same questions everyone else asks before them: your medical history, your symptoms, kind of everything that happened that day leading up to the development of symptoms. But no, this was a man who did not look at my medical chart at all and who acted completely clueless about any part of my health history or why I was there in the ER. And he asked me what my central line was for. And so I was just like, yeah, I do IV infusions every night for 12 hours. And I said IV fluid infusions. He heard IVF, as in in vitro fertilization. And he did not further clarify. All he did was mutter IVF and then immediately asked me, does your condition make you slower? And I'm like, slower how? And he's like, does your condition make your thing slower? I'm like, what slower? And then my dad speaks up and is like, did I hear you mutter like IVF? She's not an IVF. She said IV fluids. And the doctor was like, oh, that makes much more sense. I was wondering why she would be on IVF. And I just sat there thinking, I'm like, I don't know the ins and outs of IVF, but I know you don't connect it through a central line. Also, why would I be there telling you about... Anyways, that was just like the most ridiculous interaction I've ever had with a doctor. Like, you're not even going to clarify with me what exactly it is I'm infusing in my line? Okay. I brought up to him, I'm like, are you going to do labs? Are you going to do anything? And so he finally ordered blood work. And then he also ordered a chest x-ray, and I had a chest x-ray. And then he said the chest x-ray would show nothing, and it showed nothing. So I don't know why he ordered the chest x-ray. And so he was like, okay, I can, start the process to get you a CT scan with contrast to, rule out a PE. And I'm like, thank you. That was 3 hours into waiting there. It was about another 6 hours total until I got the results from the CT scan with contrast that I didn't have a blood clot. But in between, I had to get an IV. So yes, I have a central line, but I told them I do not want you guys to use it. My veins are deep and they roll, and it's always a hassle, but I didn't feel comfortable with them using my line. And also, my line cannot have contrast in it at all. It will destroy the line. That is what I've been told from day one of getting this line. It is not rated for contrast. So I got an IV in my hand in the ambulance, but they needed an IV for the contrast for the CT scan. So first, before that, the phlebotomist comes in to try to get my blood work to do my labs. So she tried to stick me and she didn't get it, and I told her she wouldn't get it because I have really bad veins. So yeah, so that's the second poke. And then on this arm, the charge nurse, which you can see that bruise maybe, the charge nurse came and she tried to insert an IV using the ultrasound machine and she couldn't get it. So she called someone down from ICU. I don't like shading nurses because they are phenomenal and they are the best. They are like on the front line, doing all of the things. I love my nurses, but the nurses in this hospital, anyways. So he comes and he uses the ultrasound machine and is like, why can't I see, the screen very well while he's barely touching my skin with the ultrasound, like Doppler thing, whatever it's called. I'm like, I could do the ultrasound better than this, and I'm not a medical professional. But anyways, he tries to get an IV on this side of my arm, to which when he gets it in, I don't know what happened internally or if it poked a nerve internally. I have never felt that immediate internal pain before from getting an IV, and I've had so many IVs over my entire life. This was like a whole nother level, and I was like, take it out. And he was trying to dig around to try to get the vein. I'm like, no, take it out now. And he took it out, and I had instant relief, but I don't know what happened. And then he went to this arm and was able to get it in here. I also bruised really bad. These bruises look a lot better than they did a week ago. But yeah, so he got me in the crook of my arm, but he put it in super crooked. So it was sticking out and I couldn't move my arm, but it was in. The reason they couldn't use the hand IV for the contrast is because I guess the contrast needed to be higher up to reach my lungs faster, I guess. So that's the story of all those pokes. And two different nurses kept coming up to me and said, worst case scenario, like referencing using my line for the contrast. This was after I told them 2 separate times that no, the contrast will destroy my line. And they kept bringing up worst case scenario. And I'm like, worst case scenario, you get an IV in me. However many pokes it takes, you guys are not destroying my central line. So that was just like a whole ridiculous thing. And so I finally get my CT scan at about 6:30 p.m. I had got into the ER at around 1 p.m. So 6:30 p.m. was when I got the CT scan, and on the whiteboard in my ER room, it had the estimated wait time. So it was like 2 hours for blood test results, 3 hours for CT scan results. And I'm just sitting there thinking, I'm like, what about the people that have something really bad show in their CT scan and they're waiting 3 hours for that result? Like, what? So I waited another 3 hours until about 9 p.m., to which the doctor finally came in and said, good news, you don't have a pulmonary embolism. But he also said, doesn't that make your anxiety and your panic feel better? Don't you feel so relieved? When he said that to me, I felt so insulted because I felt like I wasn't taken seriously the whole day. And I just heard and I saw red, and I basically yelled at him. I was like, seriously, of course, any person will be relieved, but there's something wrong with me, obviously. I'm not just here because I want to be, something's going on that's not normal. I can't lay down without feeling like I can't breathe. And it's really insulting for you to tell me that you think it's all anxiety or a panic attack. And to which he replied, I was just asking, I was just stating that. And I'm like, whatever. I'm like, so what now? What now? And he's like, well, we could admit you for observation overnight, and then you could get evaluated by the pulmonologist. But here's the thing. The next day was going to be Friday. And if you don't have experience in hospitals, that's okay. That's a good thing, actually. But how things typically work is for someone like a pulmonologist, especially in a smaller hospital, they work 9 to 5 during the week, not on the weekends. So the next day was going to be a Friday. So that pulmonologist most likely already had a roster of patients, and I was going to be added onto that. So I would be waiting all day Friday to possibly be told that, hey, you're going to have to wait until Monday when the pulmonologist comes back because they ran out of time to see you. It's happened before to me in other hospitals with different specialty doctors. I knew it would most likely happen again, especially because I felt like I wasn't being taken seriously. And at that point, I was just done and fed up. And I was like, I don't feel comfortable staying here anymore. So I decided to just go home. And once I got home, I would regroup. So once I got home, I was like, you know what? I'm going to try to get some sleep in my own bed. My vitals are fine still right now, thankfully. I guess I'll just sleep sitting straight up, and I'll hook up to my TPN. That way I won't have a big mito crash. And worst case, we head to the ER in the middle of the night. And that's kind of where I resigned myself to. I was just done and exhausted from that entire day. But I do want to mention that the only helpful thing this doctor did was order a breathing treatment of albuterol in the ER. And I did that breathing treatment and my symptoms did lessen, like the intensity of them lessened after that breathing treatment. Before that, I was so winded. I like literally couldn't move a muscle. And after that breathing treatment, I was still very out of breath and very winded and coughing, but it was not as bad. So that's also what made me comfortable coming home, is that my symptoms did lessen a bit after that breathing treatment. Obviously, I still wasn't fine, but I was exhausted. Would I give this advice to anyone else in a similar situation? No, I would advise you to go to another ER. And so I slept that whole night through the night, thankfully, and I woke up and I was better that next morning. I was still out of breath and very tired and very not 100% with it, but I felt okay enough to just keep an eye on things that day and just wait and see if I felt like I needed to go to a different ER to get seen. And so as each day went on, I slowly got better and better, but it wasn't until Monday that I felt back to myself and back to my baseline and back to, sleeping, laying flat. And yeah, so thankfully, I'm no longer out of breath. I'm no longer short of breath. I'm no longer really coughing. My chest doesn't feel tight anymore. Taking a deep breath, I can take deep breaths just fine. But it was a whole really scary experience because no one knew what was wrong. We still don't know quite what happened. And I do want to state, I have anxiety. I'm medicated for anxiety, and I have had panic attacks in the past. Anyone who has had a panic attack knows that there are panic attacks out there that make you feel like you can't breathe. This was not one of those situations. For me, I can always tell. I know my body and I know my brain and I know the way that I work when I'm having a panic attack, and what I was experiencing wasn't that. Also, I was scarily, eerily calm through the whole experience. I did not freak out. I did not catastrophize. I did not have anxiety brewing in me. And I think that was just honestly a gift from the Lord, because any other day, my anxiety would have just made everything so much worse. But the whole experience of not being taken seriously was really frustrating. And I cannot believe that it is 2025 and doctors are still blaming weird medical events as anxiety or panic, especially when it's a woman or a young woman. It's ridiculous that this is still a thing. So yeah, just remember, as exhausting as it is, you always have to advocate for yourself. And if you have the privilege, like I do, of having people in your corner who are willing to help you advocate, bring them with you to medical appointments, to ER trips, hospital admissions. It makes all the difference. And I am so beyond grateful for my parents and that they were both able to come and be with me in a really scary experience. And I'm just really grateful it was not a blood clot and that I'm okay. I think basically what happened is that I potentially had a bronchial spasm, and I started coughing and breathing just right, that as that was happening, everything just kind of got more and more irritated. And that breathing treatment of albuterol helping would make sense with that. I had sepsis 5 years ago back in 2020, and when I had sepsis, I had part of my lower lung collapse. Really painful, by the way. Do not recommend to anyone. It was not a pneumothorax, but it was called atelectasis. I think that's how you pronounce it. And since then, my lungs have just been way more sensitive, and every time I've gotten sick almost every time I've gotten sick since then, it either goes straight to pneumonia or straight to bronchitis. And so just from kind of observing myself post 2020, I know my lungs aren't like they used to be. But with all of that said, I'm going to let you guys go because my dogs are about to start barking because my mom just got home. Thanks for watching this video. Don't forget to like it, subscribe down below, and I will be coming back to you soon with more videos. Thanks for watching, guys. Bye.